Hi, I'm Martha Bray. I'm a holistic family nurse practitioner, and I just want to give you a little bit of information today on NAET. Now, this was developed by Dr. Devi Nambutrapad. She is a licensed acupuncturist, she's a medical doctor, chiropractor. She's very highly credentialed, has been around for a long time, and has done a lot of research with this particular technique. It stands for, the N is Nambutrapad, Allergy Elimination Technique. Now, even though it's termed that, I want to emphasize the fact that we are not, quote, treating allergies. We are decreasing the body's sensitivity response to particular allergens, whether it's foods or inhalants or all kinds of varieties of different things. Any age person can be treated. If we're doing a baby, for example, then we do what's called surrogate testing, where we're testing and actually treating through the mother, for example, or the father, or someone else that can substitute as a surrogate. And when you come in, we can do a demonstration on this to help you see and understand how surrogate testing can work. Now, it's important to realize that this particular treatment, although it may seem very simplistic in the approach, it does require you as a patient or a client, you have to have the ability to participate. For example, a lot of times you have to avoid a particular substance. In fact, the majority of times you have to avoid a particular substance for 25 to 40 hours. And there are very specific guidelines. We have a book that goes to every new client that gives a lot more information. This is just a little short introductory video to give you a basic understanding, but the book goes into a lot more detail on that. And the other thing that's really, really important to realize, a lot of clients don't understand when they come, is that we have 15 basic things that we make sure that we test and treat on every single client. And sometimes people get frustrated with this because they think, well, I just came because I am allergic to cats, or I came because I'm allergic to tomatoes. But you have to realize that when you do the basics, that the basics are the foundation of your immune system, and it helps the body be able to deal with any kind of stressor or allergen in a much better way. So it's critical. A lot of times, a lot of sensitivities and reactions will go away once you have done the basics. So the basics are a requirement, and it's for your good. It's not for my good. It's for your good that we do the basics first. After your treatment, as I mentioned, you will have to stay away and avoid the particular substance that we're treating for the 25 hours or 40 hours, whichever it might be. Now, during that time, some people will have what they call, quote, a reaction. And sometimes people have a little reaction, sometimes people have no reaction, and that really is very specific to your body and the particular sensitivity. If it's something that you are very, very sensitive to, the probability of you having a reaction is higher than if it's just a small sensitivity. But those are things that can be dealt with, and it isn't a problem.